Today we're going to do case number 1, simple hypochlorhydria. This is a case that's going to teach you exactly what you're going to see almost daily. A very simple case. We'll go through it step by step, and you'll see how to utilize the GastroTest and a couple other tests that will give you a real advantage in treating dysbiosis. So this was a 58-year-old female, and this is a typical complaint you see in a functional medicine practice. Most of you guys have seen this on a daily basis. Menopause symptoms, 4 to 5 years, hot flashes, extreme fatigue, anxiety, weight gain, thinning hair, upper neck trapezius pain, request nutritional consult. I've heard this multiple thousands of times, probably just like you have almost every day. Patient indicates she's been suffering from these symptoms, hot flashes, fatigue, etc. And she saw a doctor in town to put her on Bias, 3.57 milligrams in testosterone. And she was also, and she did some other things as well as thyroid medication by this doctor. It didn't help, so she went to see a nutritionist, put her on a bunch of supplements. That didn't work either. And so she's heard about us and came into the office. Her life's just miserable. She has any major diseases, and you're going to see this, but we're going to check everything. So always request the records from the other doctors, because one of the things we want to see, and we see as functional medicine is getting more and more popular, there's doctors out there that are prescribing medication, and sometimes they'll say, well, thyroid numbers look good, but we're going to put you on thyroid medication anyway. So you want to request those records to see if they were actually hypothyroid before they were put on the medication. And you're going to see this is something that happened to this patient. Often nature thyroid or ARM will be prescribed. This is what the patients want, without doing a free T3 or free T4, and you want to check that. Other stuff you can look, patient examination, 5'5", 160, 97.7, pulse 66, pulse ox 98%, blood pressure 160 over 88, 162 over 90, body comp 34%. What are we looking at here? Insulin resistance is a good possibility, or 10% over where she should be on weight, and her blood pressure is a little bit raised. Second page here, not a whole lot. She still has some neurological damage from surgery she had in her eye. And this should be right eye instead of left. Everything else is pretty normal. Age of the fillings that are being noted on here. If you haven't a lot of experience with older fillings, get with your biological dentist in your area and have him teach you what a mercury tattoo looks like. Very, very important, especially if you have a cap over fillings, that amalgam fillings on top. But look for mercury tattoos. These things leak, and they can be a cause of leaky gut too. I'm not going to talk about that today because this is a simple case, and we'll do that some other. There's a high percent of rates. There's a little bit of epigastric right upper quadrant tenderness. Not always the case with simple hypochlorhydria, but in this case it was. No real swelling, a little bit of bloating. You will also have spasm right over your pyloric sphincter and right quadrant. Bloating often not seen. Let's go through the blood work real fast. This is a pretty typical blood work. Cholesterol was okay. The good thing about cholesterol, remember our ominous sign is 140. Below 140, you're worried about the liver working properly. At 219 is a little bit high, but no, not that big of a deal. 70 HDL, so her risk factor is very, very low. That means the liver is working pretty good. Everything else looks pretty good on the page. Blood sugar is good. 96 is tiny bit high, but the A1C down here is 5.5 in normal range. She's not diabetic. Liver enzymes look good. AST, ALT, 16, 20, very good. Everything looks good. Protein's good. Everything's good on here. A1C is normal. And there you go. Second page, this is where we get into it. Fructosamine is normal. If you're not familiar with fructosamine, it's a two-week stabilized look at the blood sugar. You mix that with your A1C and your fasting, and you got a really good look at your blood sugar. Fructosamine is normal. Uric acid is a little bit high. So you get a little bit of uric acid near approaching gout, a little overweight. And her fructosamine is touchy high. Insulin resistance probably here. But the big thing here we want to see on this is your amylase and lipase. Your amylase is low and your lipase is functionally low. So our pancreatic enzymes are low. So we've got our first major find here of low pancreatic enzymes. TSH is low, So in this case, remember she had been put on medication. A lot of times these folks don't know what they're taking. Make sure you check the medication schedule and see if they're taking the thyroid they have left over. Her numbers look good, but the TSH is a little bit low, so just double check with that. SED rate is normal at 6, but watch it. You don't want to get it start climbing up there. What WBC count is a tiny bit high, not really, 5% from a functional standpoint. And you'll see this common with leaky gut. MCV is a note. It's an 88 or 88.9. 88 is what we use in our functional medicine in the clinic for microcytic anemia. This person does not have microcytic anemia, but you'll see with bacterial infections, chronic infections in the gut, you'll see not microcytic anemia, but kind of low levels of cellular iron. And it's right there on the bottom. But the big significant finding here is your neutrophils and lymphocytes reversed. Your percentage on this should be 55-25. When they're reversed like this, we want to look for a food allergy or long-term immune challenge. And in this case, you'll see that she has both. So these are very important, significant findings. So we have a couple of more findings here we want to look at. Third page, eosinophils are normal. Always check the eosinophils. Allergies, parasites, it's all clean there. So we're not dealing with any IgE allergies. We're going to be looking for IgG allergies. At this stage of the game, in a simple case like this, we're not worried too much about IgA at this thing. Everything else is good. And our ferritin levels, UA is normal, iron profile is normal. And we want to watch this ferritin. Remember, your ferritin can be a false positive. If it's too high, it could mean inflammation. So you want to keep an eye on that. We did some food sensitivity testing. It's just muscle testing here. We didn't do a food allergy test. If it's an autoimmune condition, we automatically do an IgG blood allergy test. In this case, we did some muscle challenge here. Sensitivities will change and evolve as we correct this. If there's a real allergy, if you're doing muscle testing on this, the response will get more significant if they have a real allergy as they clean up. It'll go completely away in many cases. In fact, in this case, it did go away after a few weeks. And then this is what I just said about IgG. This really helps eliminate guesswork. It also can save the patient money if you're able to do this. You don't have to spend $400 or $500 on an allergy test initially. There we go. So here's the GastroTest. Here we get down to the meat of it. The GastroTest findings. Initially, the GastroTest number 1 was an 8, so we gave 2 caffeine tablets, just like the instructions said. Challenge, you wait 20 minutes, and then you reperform the test. Number 2 was also an 8, so this confirms hypochlorhydria in this patient, low acid in the stomach. Indica is an inexpensive test. If you're not familiar with Indica test, it's a simple test, and I'll do another video on how to do this and how to interpret it. But very, very simple urine test in the office that will give you the results of dysbiosis or absorption of indican leaky gut. Very simple test to do, and I recommend that you do this in conjunction with the GastroTest. It's going to give you a whole lot of information. It was a +1. The score on the indican is 0 to 4, and the result was 1 out of 4, mild putrefaction. What the indican test measures is putrefaction in the gut. So you mix it, it kind of gives you an idea of leaky gut. And this is what I said, you use them together. So if you look at this test, this is a picture of our actual GastroTest. This was number 1, and it was all green. You just match the colors up. It's a real simple test on the string. This is around an 8 on number 1. Then she was administered 2 caffeine tablets, waited 20 minutes. We redid the test. And again, it's green here. In fact, if you notice, it's a little more green than it is here. And the reason is, and you'll see this often with people with hypochlorhydria, when you actually challenge the stomach to produce acid when it needs it with food, it actually produces less acid than when it's just resting. The beauty of the GastroTest, and what I like it so much, is it measures the resting pH of the stomach. That's very important for your acid barrier. You need that acid barrier to protect you from, if you drink something at all, for bacteria, viruses, and all that. This lady wouldn't have that. So number 1 test was around 8. Compare it with the second one. And your pH card, this card right here, comes with your starter kit. The pen comes with your starter kit that you can do all this for. You did post-caffeine. Notice it's actually a little higher, just what I said before. And this is common. So when you see this get higher instead of go lower, if it was normal, you would have a 3 right here, down on the bottom here. And you can go back and review the test that we did and how to administer the GastroTest on the videos. And you can see that test where it was red on the bottom where that patient had eaten. It should be red here. So this confirms that hypochlorhydria. So we're going to just review the primary test findings we found on this patient with a very simple case here. Dysbiosis of leaky gut, we found that on the endocrine test. You get up in 3s and 4s, then you really have to clean this stuff out and you'll be in real trouble. Pancreatic enzyme deficiencies verified with blood work. Low stomach acid hypochlorhydria verified with GastroTest and a caffeine challenge test. Reversal of the neutrophils and lymphocytes indicate food allergy or long chronic infection of some sort. We did not have high white blood cells in this case, so it's very mild. It's challenged by blood work. This milk sensitivity, we did response testing, but you could also do any type of allergy testing that you chose. Treatment considerations. We have documented exactly what's wrong with the patient. This gives the doctor and the patient a lot of confidence when you start to treat the patient. You know exactly what's wrong with them. You have the test to prove it. All you have to do, the patient's going to feel better when you, in 3 to 6 weeks, or you can go a couple of months, redo the test and you'll see what's happening. You might be thinking, well, why do I have low acid in my stomach? Well, it's going to be a process of minerals and vitamins not being right. And this person hadn't been able to digest food, break down proteins, break down minerals, absorb these things for how many years. Once they start doing this with your treatment, with hydrochloric acid and enzymes, they will start to self-correct. So you want, and we'll go through this at the end. So we documented. We also know exactly what area has to be treated first. You have to clean up the putrefaction in the gut. We use a bowel cleanse. You have to treat the low stomach acid with a pepsin and hydrochloric acid. Most critical is the stomach acid and pancreatic enzymes, and you want to tell this to the patient. You have to take these pills when you eat. And since she doesn't even have an acid barrier, you may consider very low doses even between meals, especially if she's drinking something. Next critical issue is the leaky gut and the treatment plan. Modified bowel cleanse with a broad spectrum natural antibiotic. Herbal is preferred. In this case, we use berberis and grapeseed extract, 2 TID with a modified bowel cleanse, and we're going to make a video on the low modified bowel cleanse. But there's many really good quality programs from good companies that have these bowel cleanse programs. So you can take your choice of those, or you can do something simple like we have on our videos. The HCl, pepsin, and pancreatic enzyme supplements with every meal is critical. Since you have proof of the condition, your dosage is going to be important. This is what I really like about the GastroTest. If you're not getting the results you want, then increase or decrease the supplementation. And you'll have an example of this here shortly. At this time, you want to schedule your patient weekly for 3 weeks in a row. You want to check and see how they're doing. You might need to make some adjustments in their diet. You might be finding they're doing something that you don't want them to do. You want to see how they're going along, what's going on. And remember, in the beginning, they may experience a little bit of bloating. You want to warn them about things like berberis, for example. It could cause a little bit of diarrhea, and it could also cause their stool to be kind of yellow. So you'd want to tell them that, hey, if you see yellow in your stool, don't get alarmed. Or if you get a tiny bit of diarrhea, give us a call, and we'll adjust it maybe even before you see them again. This was just a treatment sheet that we use, and we did not put the multi and the GLA and flax initially, so this was not included initially. I just used hydrochloric acid, alzyme, which is a pancreatic enzyme, and beta plus, which is it's for the gallbladder. It's bile. We ended up eliminating that because she didn't feel good on that. Did not have any documentation for that or proof. I just thought, well, this might be a good idea, and it wasn't, so we eliminated that on the first week. So we did this. So discussion. This is a very simple case of hypochlorhydria or low stomach acid with food allergies. This is what you're going to see all the time. We did a good job of screening the patient, making sure there wasn't anything significant. We requested records. All the tests she had, we cleared her from, so all she needed was nutritional type therapy. Treatment was simple, response was quick. The modified bowel cleanse, the first 2 weeks of treatment. Broad spectrum herbal was prescribed with the modified bowel cleanse. As you get into this work, you're going to find that herbal medicine is the way to go with gut problems. Occasionally, you're going to have to use antibiotics, or if you can't prescribe antibiotics, you'll have to work with someone who can use antibiotics, but almost rare. Herbs are really, really wonderful, and I recommend, and you're going to find, if you've had the same experience as I have over 30 years, that the powdered herbs and capsules work the best. But again, there's such good nutraceuticals out there with great companies. You can choose the one you choose. Be careful of your Hersheimer's reaction. That's die-off. People get sick, especially with antifungals. I'm not going to get in detail on antifungals today, like castor bean oil. Berberis is a very, very mild. When you have a mild case like this, you want to use mild herbs. Don't use just real strong herbs. In natural medicine, we don't want to, let's get all the stuff up here. We don't want to use a really stout herb in a mild case, and we want to be very careful. Don't be afraid to use large doses. But like I said, you can cause diarrhea. Okay. You can do advanced stool testing, and this is what I would tell the patient in a case like this. Let's go through and do the simple stuff first. And if you don't get better, then we're going to do advanced testing. We'll find out what bacteria, what fungus, and all that's in there. If you choose to do that ahead with your patient, that's fine too. It's great to have that information, but you need to know what the food sensitivities are. You really need to know the metal status, and you absolutely be nice to know everything, but this gets very expensive. You can make that decision with your patient. So in this case, we just did a simple treatment program with follow-up. So the patient was seen weekly for 3 weeks. The second week, the patient reported 30% improvement in overall symptoms. By week 4, she reported the following: 60% improvement in gastrointestinal issues, 0 constipation, bloating, and discomfort. 100% improvement in sleep, no changes in anxiety, but she wasn't depressed anymore. In fact, she was very happy. And a little clinical thing that I've seen over 30 years is on females, when they start to feel good, they start to dress up when they come in your office. They'll put makeup on and they'll put new earrings. And so you don't even have to hear what they're saying a lot of times. You know immediately when they walk through the door, she's feeling better because she's fixing herself all up. It's not the case necessarily with men. Neck and shoulder pain reduced by 50% without doing any type of therapy. 0 hot flashes. The modified bowel cleanse was reduced to 2 times a day. There were no changes in the HCl therapy and pancreatic enzyme therapy or vitamins, and the vitamins were added at week 3. I'm going to run this pancreatic enzyme therapy and hydrochloric acid therapy probably 6 months to a year, depending on what the retest shows on the GastroTest at about month 3. If it starts to normalize, I'll adjust the dosage, but you want to get those minerals, proteins, and all that absorbing, and you need that stomach acid. Don't be too quick to adjust the hormones. In this case, she responded very, very well. Let the body heal and see what corrects itself. When you correct this huge, big deal with stomach acid, lots of things and lots of positive things happen. 6-week patient follow-up, 80% improvement in GI symptoms, 0 constipation, reports normal stools, no bloating, no discomfort. People who have had gastrointestinal problems and they all of a sudden are using the bathroom and sleeping, they are very, very happy. And you're happy because you did your job as a doctor. Sleep still 100%, anxiety better, and still no depression. Neck pain and shoulder pain, 0. However, she did receive 2 thoracic and cervical adjustments, eliminated her pain completely. Hot flashes, 0, no change in the eye, drooping. I didn't expect that. It's a neurological damage. The patient requested, and you're going to see this too, they know this has helped them. They requested to remain on the bowel cleanse because they felt so good on it. Her stool wasn't normal without it. So we stopped the biodophilus, which is an acidophilus type product, Stay with the chlorophyll, which is part of the bowel cleanse, and I told her she could stay on it for life if she wanted to, and she can. We'll put her on a maintenance program after I do the next follow-up test on the GastroTest. And the maintenance program is you'll do a full bowel cleanse 1 week out of each month with the herbs or medication that you have them on. And you do that for 6 months to a year. And this will normalize their gut function once you get the acid stabilized and the pancreatic enzymes producing on their own. Schedule all your retesting for the 3rd month of the program at this stage when they're doing well. Conclusion. The key to success in our functional medicine is testing and retesting to prove your diagnosis and see if your treatment worked. The GastroTest, as you saw in the picture, the GastroTest and Indicum were a great help here. Without the GastroTest, I wouldn't have fixed this patient. I wouldn't have gotten her well at all. I would have had no idea if she needed hydrochloric acid. Explain the test results and consequences during your reported findings, and they will remember the test. These patients, they will start asking for the test. Hey, doc, can I have that test again? I want to know where my acid's at. Hey, can I have that other test? I want to know if my gut's cleared up. They'll start coming in and say, I want my blood work. I want to know what my enzymes are. And it really is a patient, it's a practice builder. Your patients, and that's what I just said, they'll start requesting. Your confidence will soar. And then you'll adjust the therapy because you know what the problem is. You're not going to say, okay, well, let's try to give you these tablets. If it doesn't work, then I'm going to stop it. You may have jumped right over the problem. But if you absolutely know exactly what the issues are, you can adjust your therapy and stick with it until you get it right. And then you get your patients well. Remember, this is functional testing, not disease testing. We're not testing for a specific disease. We're testing to see what's working and what's not. So returning test findings to normal produces health and freedom from pain and suffering. And that's our job as natural medicine physicians. It's not to just reduce disease and suffering and pain, but to produce health. And the GastroTest is, in my opinion, the best way to start with any gastrointestinal problems. And you can use this to check quantitative data to adjust your therapies. If you have any questions, you can always ask for a consult at the GastroTest numbers.